Hello everyone and welcome back. In this video, I want to talk to you about efforts to treat and destigmatize addiction. So there is a doctor at UCLA who's leading this effort. Good for him. I'll put a link to the article in the description for the video. Dr. Julio Meza lost two family members to addiction-related illnesses when he was a child. Now, as a UCLA Health physician, he leads a program providing doctors with addiction-specific training. This is so important, okay? He's training other doctors on how to deal with these issues, right? You know, I can't tell you how important this is, primarily because a lot of folks, when they're dealing with issues at home, they have a loved one with a behavioral health issue, who do they call? They call their doctor. They call their doctor. So I think this is really important. Addiction impacts tens of millions of people in the United States annually, according to the National Institute on Drugs and Addiction. UCLA ranks as one of the top institutes in the U.S. for federal research funding in addiction medicine, which is a medical subspecialty designed to prevent, diagnose, and treat addiction. I guess one of his colleagues, Nicholas Masali, said he's working on developing new medications for pain that have less addiction potential. Yeah, I mean, I get it. Look, I don't know if you know this, but I had my arm, last year I had my arm repaired surgically twice. Both times, the surgeon, super nice guy, great doctor, wrote me a prescription for oxys. And I said, Doc, you know what I do for work? I said, I'll never take these, right? He said, look, you're going to be in, significant pain. I mean, the second time they had to graft in, material from a cadaver into my elbow because it was so damaged. I said, Doc, I'll take 2 Tylenol. If that doesn't work, it's just too bad. I'm not taking that medication. And I flushed them down the toilet, I'll be honest with you, because oxys are very addictive, and I wasn't going to take them. And, I got through it. When we talk about destigmatizing addiction, we mean that it's now considered a mental health disorder rather than 30 years ago it was considered a weakness for people not to be able to stop taking drugs. Pain is a silent epidemic in our society. We talk about the opioid epidemic because it's killing people. But 20 to 25% of all Americans at all age groups and all socioeconomic classes suffer from chronic pain. And we don't have good pain medications for these patients. Yeah, I get that too. I've got 2 herniated discs in my neck. I get an epidural every 90 days and I take a pain med. Now, it's not addictive, as far as I'm aware, but it works, right? And my neck, for the most part, I'm pain-free. But there are times when my neck really starts to bother me and I get shooting pains, across my traps and into my shoulders, and it's very uncomfortable. So this is good stuff. I'll put a link to the article in the description, but I'm interested to hear what you have to say, because sometimes, one of the conversations I have with parents is the idea that this is a conscious decision by your loved one to be sick. And sometimes one parent will say, I don't understand, why doesn't he stop? Why doesn't she stop? And my response to them is, if they could, they would, right? This is as if their brain has been hijacked or kidnapped, however you want to phrase it. And so they're not capable of making the decision to save themselves. They're probably in complete and utter denial, right? I'm sure you're familiar with that when they say, there's nothing wrong with me, you're the ones that need to go into treatment, or you're the ones that need to go and see a therapist. I'm fine, even though their life is, using any rational objective standard, is a complete shambles. In fact, it's just chaos. So when you can accept that it's a disease, then you can talk about how to treat it, okay? If you're going to presume that it's a conscious choice, then that's akin to banging your head against the wall, trying to convince your loved one that they need to stop, right? I mean, it sort of almost harkens back. I remember this when I was a kid growing up, and you had, the Nancy Reagan TV commercials, just say no. Okay, I think we're past that. At least I hope we are. In any event, I'm interested to hear what your thoughts are. Do you agree? Do you disagree? Is there still stigma out there? Are you a family out there who's got a loved one who's been suffering for a long time? If you are, I'm interested to hear what you have to say and talk to you about what options may or may not be available to you, both legal and non-legal. And if there's an issue in your family that you're seeing and I haven't made a video, let me know. I'll make you a video, because if it's affecting your family, good chance it's affecting somebody else's. And I make these videos so you can get the information you need. Not what you find on Google, not what you find in ChatGPT. 99% of that stuff is garbage. And I'm getting calls from people who say they're doing their own research on ChatGPT. Well, how many Marchman Acts, guardianships, Baker Acts, how many cases has ChatGPT actually handled? And I say that tongue in cheek. I'm not trying to be, maybe I am trying to be a little sarcastic with you. The point is, ChatGPT is not a good source of information, right? And neither is calling a lawyer who never handles these cases. And I say that with all due respects to my colleagues, because starting to see other lawyers handling these cases and they've never handled them before. I've had a family member Baker acted. I was there when it went down, and my office is probably represented way over 800 people right now at this point. We file about 250 cases every year to get people out of the mental health system. And we also have filed hundreds of other cases to put people into treatment. So I just share that with you. If you like this content, please give me a thumbs up. If you want more of this content, please subscribe to the channel. And with that said, thank you for tuning in. I'll see you in the next video. Bye-bye.